Hello and welcome. I'm so glad you're here. We're going to create a really gentle and supportive space to talk about some of the changes you might be noticing in your body. And we'll be drawing on the amazing expertise from the Women's Health Clinic to help demystify a topic that, affects so many of us but is often really misunderstood.
So let me ask you, does this sound familiar? You're still getting your period. Maybe it's regular, maybe it's a bit all over the place, but at the same time, you're feeling new things like dryness or irritation, maybe even some pain. If you've been feeling confused by all this, I just want you to know you are absolutely not alone. It's so common, and we're going to figure it out together.
Okay, so let's start our journey today by just acknowledging how confusing this whole phase can be. We're going to dive right in and talk about these symptoms that so many women feel during perimenopause. It really can feel like your body is sending you mixed signals, can't it? I mean, on one hand, getting a period seems to say, hey, everything's working just like it always has. But then you're feeling these other symptoms you probably thought were for a much, much later time in life. So we are going to bring some much-needed clarity to this.
So how do we make sense of it? Well, let's gently pull back the curtain on the science behind these feelings. The key to really understanding what's happening, it all comes down to one crucial hormone, estrogen.
The official name for all of this is Genitourinary Syndrome of Menopause, or just GSM for short. Now, I know what you might be thinking when you hear that word menopause. It can be pretty misleading, right? But here's the most important thing to know. This is not just a post-menopause condition. It can, and very often does, start years before your final period.
Just take a look at these signs for a moment. Do any of them feel familiar? That nagging dryness or itchiness, sex becoming uncomfortable or even painful, or that feeling of always having to rush to the loo. Just seeing your own experiences written down like this is the first step. It validates what you're feeling. It's real, it's physical, and it actually has a name.
So what's actually going on inside your body? Well, during perimenopause, your estrogen doesn't just neatly decline, it becomes really erratic. It's like a roller coaster, and these unpredictable dips are enough to affect your body. As you can see here, it causes the delicate vaginal tissues to get thinner and more fragile. It reduces your natural lubrication, and it can even change the protective pH balance down there, which makes you more vulnerable to irritation.
And this is such a key insight from Dr. Farzana Khan at the Women's Health Clinic. She makes it so clear it's the fluctuation, the wild ups and downs, that's the real driver here. Even just temporary dips in your estrogen levels can be enough to, as she says, starve the tissues. And that's what causes symptoms, long before your periods have actually stopped.
This is one of the most confusing early signs, but it makes so much sense when you understand the why. Have you ever been absolutely convinced you have a UTI? You've got the burning, the urgency, but then the tests come back negative. This is often called a phantom UTI. It happens because the urethra is also really sensitive to estrogen, and it gets irritated when levels dip. For so many women, this is the very first clue that hormonal changes are starting.
Knowledge is just so empowering, and a huge part of that is clearing away some of the myths that can really hold us back from getting the support we need. So let's tackle a few of the most common ones.
Okay, let's bust this first big myth right now. The idea that you might be too young for these symptoms, or that they can't possibly happen while you're still getting a period. It's just not true. As we've just learned, that hormonal roller coaster of perimenopause can start in your early 40s, or for some, even your late 30s. What you're experiencing is completely valid, right here, right now.
This next myth is a really tender one, and it's so important we talk about it with compassion. If you're feeling discomfort during intimacy, it is not a reflection of your desire, your relationship, or how aroused you are. This is a physical, structural change happening in the tissues because of a drop in estrogen. It is a medical issue, not an emotional one.
And now we get to the most hopeful and important part of our chat. Because understanding the why is one thing, but knowing there are clear, supportive ways to feel better, well, that's everything. Let's look at how you can start feeling more like yourself again.
When we think about managing GSM, it helps to know you have a whole range of wonderful choices. We can kind of break them down into two paths. There's supportive self-care and lifestyle habits that bring immediate comfort, and then there are medical options that actually get to the root hormonal cause. There's no one-size-fits-all here. It's all about finding what feels right for you.
So, on the self-care side, there are some really simple, gentle things you can do straight away. Using a good quality vaginal moisturizer regularly, and I mean daily or every few days, not just for intimacy, can really help. Lubricants are your best friend for making sex more comfortable. And just be mindful to avoid irritants like harsh perfumed soaps. It can make such a difference to your daily comfort.
Now, for those who feel they need more support, medical solutions are so effective. The gold standard treatment is vaginal estrogen. It works right where it's needed, with almost none of it being absorbed into the rest of your body, which makes it incredibly safe for most women. It actually helps restore the tissue's health and natural moisture. And of course, having a chat with a menopause specialist can help create a plan that's perfect for you.
As we empower ourselves with all this knowledge, it's also really important to know when to check in with the doctor. Please don't see this as a scary list of warnings. Think of it as an act of profound self-care. If you ever have any unexpected bleeding, pain that doesn't go away, or anything else that just doesn't feel right for you, please just have a chat with your GP to make sure everything's okay.
All of this compassionate, clear information comes from a deep, deep well of expertise. It's so important that you can trust the guidance you receive. So let's properly meet the expert behind the Women's Health Clinic.
This is Dr. Farzana Khan. As you can see from her qualifications here, her expertise is just incredible. With a medical degree, specialist diplomas, and more than 2 decades of experience dedicated to women's health, she brings such a depth of knowledge and genuine care to our patients.
And this really says it all about her philosophy. It's not just about what she knows, it's about how she shares that knowledge. Her entire approach is built on partnership, making sure you understand what's happening, you know your options, and that you are right at the center of every single decision. It's expert help that's also deeply, deeply compassionate.
So, I'll leave you with this gentle question to think about. Now that you have this understanding, what's one small, kind step you can take for your body today? Maybe it's just buying that moisturizer. Maybe it's finally booking that doctor's appointment. Or maybe it's simply giving yourself a bit of grace and acknowledging that what you're feeling is real. Whatever it is, I truly hope this has left you feeling seen, understood, and empowered.